Welcome everybody and good evening. We are here tonight for our TIF Talk Tuesday. You will notice that we are live in studio here and we have the great pleasure of having Dr. Gilbert Simoni. Thank you so much for being here tonight.
Thank you.
We really appreciate it. I'm Andrea Millers with Endogastric Solutions. Thank you for all of you who are joining us this evening. We do have a special event for you today. We are talking about the TIF Diet. So you're going to see some fun stuff tonight. But before that, I just want to give a quick reminder. If you are watching and tuning in, please put where you're tuning in from. We will be giving away a TIF tumbler tonight. In addition to that, we will be taking any questions live. So if you have any questions, please feel free to type them in the comment section and we will do our best to answer the questions during every segment. So I'm gonna first introduce Dr. Simoni. You might have seen him. He's been here a couple of times with us for TIF Talks. Dr. Simoni is a gastroenterologist and natural orifice surgeon here at Advanced GI in Thousand Oaks, California. He's been doing TIF since 2009, is that right? Yeah, gosh. I think I asked you, how many TIFs do you think you've done?
I have no idea.
Yeah, hundreds,
Yeah,
right?
Hundreds of TIFs.
Fantastic. Well, let's first talk about, we're here to talk about GERD and the TIF procedure. So maybe you can talk to us a little bit about what is GERD, what could patients potentially be feeling if they have GERD?
Absolutely. Well, thanks again for that introduction, and thank you all for being here. We'd love to hear from you guys. Any questions or comments, it would be appreciated. Once again, I'm Dr. Simoni. I'm a gastroenterologist here in Thousand Oaks in Southern California. Let me just begin by giving you an idea of what GERD is for those that know what it is. I'm just going to give you a background and then tell you a little bit about TIF as to what we do. So GERD, or gastroesophageal reflux disease, is a condition where contents of the stomach actually splash back up into the esophagus and sometimes can come all the way back to the up to the back of the throat or even down into your windpipe or lungs, and can cause various symptoms, starting from typical symptoms such as heartburn, regurgitation, or burning sensation in the middle of your chest. So those are some of the typical symptoms, to sinusitis, chest pain, dental erosions, sinus issues, postnasal drip. So these are all symptoms of gastroesophageal reflux disease. Now, what causes gastroesophageal reflux disease? Despite a lot of misconception, GERD is actually not because of increased production of acid or having too much acid in your stomach.
Right.
It's because of anomaly of a valve or looseness of the valve that actually sits between your esophagus and your stomach. So it's at the top of your stomach, and when you eat food, food goes through the valve, and the valve prevents the contents of the stomach that is acidic from coming back up into your esophagus upon various positions, upon laying down, bending down, or even sitting up sometimes.
Right.
And it almost always coincides with a hiatal hernia. So these are some of the things that you're going to be able to see in a few seconds. We're going to show you a video that basically it's an animation showing you what we can do to fix it. So what are the things that we can do to fix gastroesophageal reflux disease? You probably have all heard about diet. What are some of the things that you should avoid in order to not have reflux? There are medications that you can take that will reduce acid, but as I said, the problem is not increased acid in your stomach. The final and the best real treatment for GERD is actually fixing the valve. And the most recent treatment that we have, which is an endoscopic non-invasive treatment, is called TIF, or transoral incisionless fundoplication. As Len mentioned, I've been doing that since 2009. So this procedure actually fixes the valve and prevents you from having reflux or the contents of the stomach coming back up. It actually recreates the valve to its original shape.
Yeah, Fantastic.
So I think we have a video that we're going to show.
We
I
do.
don't know if there
Yeah.
are some other questions that
Yeah,
you have.
let's see if there's any questions
Sure.
before we show
Love
the
it.
video. So Taylor, do we have some questions?
Absolutely.
Curious to know if I can significantly reduce my reflux symptoms and avoid the procedure altogether by just eating healthier.
So I don't know if you heard that, but I'll repeat it
Sure.
just to make sure everyone can hear. But they're basically asking, can they fix their reflux without having a procedure by strictly having a better healthy diet?
Excellent question. Most, if not all, reflux issues are related to the valve. So if you really want to have a complete or a final fix, if you will, of the condition, you really need to tighten the valve. It depends on if that's really the cause.
Right.
There are other things that can actually cause gastroesophageal reflux disease or symptoms of gastroesophageal reflux disease. So diet and avoiding certain things and eating healthy, it is going to help.
Okay.
However, it's not a complete resolution or actual remediation of what you can have to fix the underlying problem.
Right.
If you have a mechanical problem, it cannot unfortunately be fixed with just diet or changing your habits. It will help.
Right.
But eventually you will need to have the valve fixed.
Perfect. Thank you. Taylor, any other questions?
They're asking, how does the TIF differ from LINX?
Okay.
All right, that's a great question. So
Yeah.
I'll repeat the question. How does TIF differ from LINX? So I'm a little bit biased, so I do not refer for LINX. The difference between the two is that the best way for me to explain it is that LINX is placement of a ring on the outside of the esophagus. It's essentially like putting a noose around your esophagus. TIF, on the other hand, is recreation of the normal valve that's supposed to be there. I don't know how else to really explain it,
I like
except
that.
the fact that the TIF is much more closer, or it resembles a natural valve that's supposed to be there, or a healthy valve, as opposed to LINX. And you know, again, I'm a little biased. I've seen, unfortunately, a lot of different complications with LINX patients, but that's basically the difference. So LINX is a noose from the outside. TIF is an actual recreation or reshaping of the valve to the original form.
Perfect. Thank you so much. So we're going to go ahead and watch an animation of the actual TIF procedure, and then we'll be right back.
Excellent.
The esophax technology is designed to rebuild the valve from inside the stomach using a transoral approach, with the goal of creating a partial fundoplication that measures 270 degrees in circumference and 3 centimeters in length. An endoscope is inserted into the center channel of the esophax device and provides direct visualization for the TIF procedure. While under general anesthesia, the device and endoscope are gently glided through the patient's mouth and into the stomach. The stomach is inflated and the endoscope is advanced and retroflexed so that it is looking up at the gastroesophageal junction. The valve reconstruction starts with the engagement of the helical retractor at the gastroesophageal junction. Then, tissue is retracted into the tissue mold as the esophax device is rotated, wrapping the fundus toward the lesser curvature of the stomach. A small hiatal hernia can be reduced and the intra-abdominal length of the esophagus can be restored using suction built into the device. The trigger handle deploys a pair of non-absorbable polypropylene H fasteners above the GEJ to oppose the fundus to the esophagus. This retract, wrap, oppose process is repeated in specific locations to ultimately create an omega-shaped valve. Approximately 20 serosa fuse fasteners are placed during the procedure to recreate physiological anatomy and help prevent refluxate from entering the esophagus. Studies show that in the weeks following, serosal fusion occurs by creating a layer of fibrous and fibroelastic tissue that secures the full thickness plication. Clinical efficacy and durability of the valve have been confirmed in randomized long-term and sham-controlled studies. Well-selected TIF patients report consistent, durable symptom control, and physicians have noted improvements on objective diagnostic measurements. The TIF procedure has an exemplary safety profile and avoids uncomfortable long-term side effects associated with traditional fundoplication.
Welcome back, everybody. So what we're going to do today, Dr. Simoni, something fun. We are going to go through the progression of the diet post-TIF. So we're going to go through weeks 1 and 2 right now, and we're going to look at some of the foods, and then you can kind of talk a little bit about, what you recommend for your patients. And then again, if you have any questions at any time, please feel free to type them in the comment section, and we'll do our best to answer them. So let's look at this week 1. We've got this kind of like green thumbs up for week 1 and 2. So lots of food here, right? We've got some apple juice, some coconut water. We have this nice little electrolyte water.
Sounds good.
Needed, not needed. I don't know. You can tell us a little bit about that.
Water's good.
Yeah. And then like protein shakes, right?
Uh-huh.
Whether it's boxed and mixed in or Ensure
Sounds good, yeah.
drinks. Clear. So talk a little bit about what you recommend for, we have our post-op TIF diet,
Correct.
and I think you've created one of your own as well. So talk to us a little bit about your post-op, the good stuff that people can have after.
Absolutely.
Yep.
All right, first of all, you're making me hungry with
I
all
know.
this here.
Well, this side or that side? I don't know. That steak is looking good.
I don't know. All right,
Okay.
so yes, the best way to think about post-op or post-TIF diet is you really need to slowly and gradually ease food in, because we're really creating the valve, and there's some inflammation around it, and we really don't want to put too much pressure on it. So the way to think about it is week 1 and 2, you need things that you don't have to chew.
Okay.
That you can actually drink. You don't have to chew it or
I like that.
swallow it. So water, very important. Probably of all of this is probably the most important.
Okay.
So everything you see here is all liquid.
Yep.
All right. So water is good. These are breakfast
Drinks.
drinks, which have about 13 grams of protein. I'd like a little bit more protein than that, so you can add more protein to your shakes. So shakes are good.
Okay.
Just one word of caution: the first few days after TIF, you may have a little bit of gas and bloating. So if you already have issues with lactose or drinking regular milk, stay away from that and use other types of milk. I think we have
we had oat milk in
oat
here.
milk.
Yeah, that one's
there's chicken
clear.
broth.
Yep.
So things that do have protein in it. If the things that you're drinking does not have enough protein, you can have protein drinks that you can buy.
Okay.
Ensure, or there's something called Isopure. Not that I have any interest in any of those financially, but
Sure.
Ensure and Isopure are some of the things that we recommend. Fruit juices, especially things that are clear and not citrus.
Okay.
So those are good.
What about Jello? You had mentioned something about the red
Jello
Jello.
is good. The
Okay.
only word of caution I have about red Jello within the first few days is that because we are worried at times about bleeding or having an issue
okay.
with blood, you don't want to have red Jello, because then patients are going to, if you have
Right.
cough up anything, or you have a little bit of nausea or vomiting, you're going to have blood
Jello
red coming up,
and they're going to say, "I'm bleeding."
bleeding.
Okay.
So avoid red Jello the first few days, but you can have that within the first week or 2.
Okay.
I would say probably after 3 or 4 days. So liquids, more protein. You can add protein powder to your liquids. So
Okay.
That's
Fantastic.
This is all great stuff. These are all tea. I think you have
Yeah,
there. Coconut water.
yeah, it's a nice herbal decaf tea as well.
Beautiful. Perfect.
All right. Well, I feel
All
like
right.
we don't have to say much about the nose, right? The breads,
Oh yeah.
the
Okay.
steak and wine.
Absolutely, yeah.
Looks like we're gonna go have dinner after
Yeah,
this. So
right?
we're gonna
That
go
sounds-
grill
that sounds-
ourselves some steak after this.
Well, that's not fair to the post.
Oh, yeah, you're right. You're right. You're right. You're right. Okay. So before we end, let's just see if there's any questions from Taylor from the audience. Taylor.
Will food catch on the TIF fasteners?
So yeah, I'm going to repeat this to you, and they're asking, will food get stuck on the TIF fasteners? So that's a good question.
I have really never seen food getting stuck on the fasteners. Generally, the fasteners are really tight and they're embedded into the mucosa. It would be very unusual. The first couple of weeks, you're not going to have any stringy foods or
Right.
strainy foods or things that have actually a lot of fiber in it. So by week 3 and 4, the fasteners have really embedded themselves. So I've never seen, to be honest with you, food getting stuck on the fasteners.
Okay.
So, but great question.
Great question. All right.
Thank you.
Do we have any other questions, Taylor?
Is the TIF good for silent reflux?
Okay. Is the TIF good for silent reflux?
Absolutely. I think one of the areas where TIF helps the most is silent reflux. So just to let you know what silent reflux really is the conditions that don't necessarily cause typical symptoms like
Right.
heartburn or
Okay.
chest burning or burning sensation in the mouth. So these are all things that we don't attribute or we don't usually think about as being part of GERD, such as chest pain or sinusitis, cough, clearing up the throat.
Perfect. All right.
Excellent. Good question.
Good questions, guys. All right. Well, up next, we are going to have Lynn, who is from Endogastric Solutions, and also one of our patients that you may have met in the past, Dylan Grove. He's going to talk about his first week 1 and 2 experience post-TIF. So take it away, Lynn and Dylan.
Excellent.
Okay, wonderful. Well, thank you again for being here tonight. We have the great pleasure of having Dylan Grove with us this evening. Dylan, thank you so much for being here and sharing a little bit about your journey with us. Dylan's going to share some of his diet favorites while he went through the GERD or the TIF recovery diet. And so he'll share some of his favorite recipes during weeks 1 and 2, 3 and 4, and 5 and 6. So don't miss, come back and see what Dylan has to share with us. But right now, we're going to talk a little bit about weeks 1 and 2 and what that experience was like for Dylan. So Dylan, tell us a little bit about week 1 and 2. What was that like for you, and what kind of foods got you through that healing period?
Yeah, thank you, Lynn, and it's always a pleasure to hang out with the Endogastric team, so thank you so much for having me. Yeah, I wouldn't really describe it as food necessarily that got me through weeks 1 and 2. Definitely, I would say prepare beforehand. Go out and buy all these things that I'm going to mention to be prepared. I would say the first thing that was the easiest to do, that probably gave me the most fulfillment, I guess you could say, would be like a protein shake. So it would just be ice, whatever kind of protein powder you like, maybe like a greens type powder or something, some other kind of supplemental powder that your stomach can handle, and then some kind of milk. Preferably, I like to use almond milk or coconut milk or oat milk because I think it's easier on the stomach in the beginning. And that's really it. Like, that was really in week 1, especially the first 4 or 5 days, probably the most wholesome thing that I could drink. I won't even say eat because it's not like eating. So yeah, ice, protein powder, another supplemental powder, and almond milk. And then yeah, like, water is important, but my experience personally was that it was very hard to just constantly drink water in this period because I was very hungry and liquid was the only thing that I was taking in. The water was hard, So I would say try to get the hydration from H2O through ice, like popsicles, Jello was really good, ice cream, applesauce, just things that are very, very liquidy, and easy to go down. But yeah, those, that shake was something I think that was very easy to do, that kept me very full.
Wonderful. Well, thank you
Yeah.
for sharing that.
So Dylan, when you prepared that shake, would you prepare it in a shaker container, like something like this, where you can put it all together and shake it up and drink it without a straw to reduce that gas potential?
Yeah. And yeah, the ones you can get them really cheap with the little ball in there, like you have, that makes sure everything gets shaken. That's exactly what I used. Yes.
Perfect. And how about any gas, or how did you manage any gas that you might have encountered during those weeks? Was that something that you did encounter, and how did you overcome that?
Yeah, definitely. So there's like I think I could be wrong. Like I don't know I think the gas kind of travels upward a little bit, and then I got this very strange pain in my shoulders that I think was from gas traveling up out of my, trying to get out. So that was one thing that was really, really weird. And then definitely feeling bloated, feeling like my abdomen was kind of swollen. Not to be gross, but like lots of releasing of the gas, farting. I mean, that's just a real thing. That's what it is. But the gas has to come out, right? And I would just like strongly recommend and suggest to just follow the recommendation from your doctor in terms of the medication that they provide. So whatever that regimen may be, whatever those medications are, just follow that, because I followed that from my doctor and it helped. It helped to relieve the gas, the pain. Definitely there was some pain in the first couple days. But yeah, that, over-the-counter stuff for gas, if it's okayed by your doctor, that worked for me. Yeah.
Fantastic. Well, thank you very much for
sharing that with us. So folks, just to recap, a nice smoothie, make sure it's, you add your protein powder in there, your greens, ice, milk if you can tolerate, oat milk if not. Shake it up nice in a shaker and drink it without a straw. And just keep running everything past your doctor. If you have any experiences that are odd or uncomfortable, definitely talk to your doctor about it. But Dylan, thank you so much for sharing your special diet in week 1 and 2. And right now we're going to run through a quiz. So we're encouraging you to post any questions you might have for Dylan in comments, but also when we run this quiz, post your answers in comments. And we'll return with Dylan here later on in the episode to share some more of his diet tips and tricks.
Welcome back, everybody. I think we're back on. Welcome, everybody. Thank you, Lynn and Dylan, and thank you for sharing your story, Dylan. That shake, I feel like I want to make that right now. It sounded so good. So we're back again. If you're just coming on, we are going through the post-op TIF diet, and we are now in weeks 3 and 4 with Dr. Simoni. So again, we have that kind of the good stuff versus the bad stuff for weeks 3 and 4. So we've got a lot of things here on the good side, right? We've got bananas and eggs and avocado. We've got some soup, and maybe you can talk a little bit about
Mashed
the
potatoes,
soup. Yeah, mashed potatoes,
ice
yogurt,
cream.
ice cream. I think I remember hearing one of Dylan's favorite was ice cream, so that is in there. But Dr. Simoni, tell us a little bit about 3 and 4. What can patients do once they hit their 3rd and 4th week?
All right, so just to give you an idea, the first couple of weeks may sound really terrible because you're only going to be drinking liquids. So a lot of people are going to be looking forward to having something that has some substance.
Yeah.
So week 3 and 4, basically what you're going to have are things that are going to be soft, that you don't necessarily have to chew, or you have to chew very little, have very little energy into chewing it. Like soft eggs, that's a good idea. We have mashed potatoes.
Yep. Some good old mashed potatoes here.
That's really fine. Avocados. We have applesauce.
Yeah.
That's perfect. We have some soups. Again, if you have issues with lactose intolerance, try to stay away from milk products or creams, but yogurt certainly is a great idea, in addition to the previous week stuff that you could also have.
Yeah, I have a question because it's come up.
Mm-hmm.
I know that they can eat soup during 1 and 2, but you really want nothing in it, right? Like with rice or noodles in it or whatnot.
Excellent question, yeah.
And then in week 3 and 4, can they, or should they, like I heard a secret that you can strain your soup. Is that right?
You can strain your soup. You have a little bit more substance in it.
Okay.
But I don't want you to have any vegetables or things that are fibrous or things that you actually have to chew and swallow. So try to stay away from those. I also, what I do is I talk to patients individually to figure out what they can tolerate. Sometimes you can tolerate a little bit more than others. And certain things, for instance, ice cream, I think there was a question about spasms or something to that effect. So yes, a lot of people after TIF may have esophageal spasms. So if you drink something that's too cold or too hot, you will have spasms. So try to keep things in room temperature. If you enjoy ice cream, you can have ice cream, but try not to swallow it cold. You can have it melt in your mouth before you actually swallow. Right. So these are some of the things that you can do to prevent. And don't gulp things. Try to do
Eat
slowly. As Lynn and Chad were talking about, to eat it slowly and drink without a straw. That way you don't swallow a lot of air.
Yeah.
So that's basically week 3 and 4. Okay. Again, bananas are very helpful. It has potassium. Another thing that I really want to stress on is fluid intake, water intake. Even though you've been on liquids for a couple of weeks and now you don't want to drink anymore, but water is your best friend. Please drink.
Hydrate.
Absolutely. Hydrate yourself. Drink a lot of water.
Fantastic.
Thank you.
There is something that's on that table over there, and if Taylor, you can bring it over to me, because I want to bring this up here, those little bottles right there. Interestingly enough, a lot of patients I've heard, and we've had some patients on our TIF Talks talk about baby food. Is there protein in some of these baby foods?
Yeah.
Okay.
Some of them have protein. The ones that have like
the pea or the chicken. Okay.
Pea sometimes have it.
Okay.
Certain legumes, if you get it.
Carrot.
Carrots don't have as much protein
in it.
But sometimes sweet potato might have a little bit of protein.
Sure.
So you just have to look at the contents and get things that have high protein.
Sure.
The general rule of thumb for post-TIF or any surgery really, I'd like patients to get somewhere close to about 30 grams of protein per
Okay.
meal.
Okay.
Okay, so that's a general rule.
Right. So we put carrots here, but you could just eat the carrots in a bottle.
Yeah, do not eat these carrots.
No.
Okay, these are really hard, and you don't want to
Yeah.
have to chew up.
And we've got citrus in here. Can they blend this cake up and potentially eat the cake?
No, this is a lemon cake, so
Okay.
it has citrus.
That's a good point.
No, I don't think you should blend it. You shouldn't blend chips
Potato
either. First of
chips.
all, I don't know how tasty it's going to be, but the whole point of having chips is to actually have some
Crunchy.
some crunchiness, right?
Right.
So no, I would not really ruin it for you. So this time goes by. It might feel very slow, but once you go through it and you get this done, it's really going to be rewarding at the end of the day.
Fantastic. Thank you, Dr. Simoni. Taylor, do we have any questions?
Somebody asked another person that had the procedure and said, how much weight did you lose and
Okay.
when did you start eating?
That's a good point. So someone's asking, I don't know if you could hear Taylor, but they said, how much weight did you lose from this diet? I can assume, liquid diets, you're not eating as much. Dr. Simoni, in your experience, what's happening with these patients? Are they losing weight? When do they gain it back? Yeah.
So most patients do lose some weight.
Okay.
My experience has been somewhere between 10 to 15 or upwards of even 20 pounds. Some of the patients actually want to lose the weight.
Yeah.
So the key is to actually keep the weight down, and you don't want to lose you don't want to gain
little
the weight
kickstart,
back,
right?
yeah, and eat overeat or increase your weight. So
Sure.
for those that are really thin and they don't have a lot of reserves to lose to begin with,
Sure.
the key is to make sure that you increase your protein, increase your fluid intake.
Love it.
And one of the things that happens after TIF, you have to understand, is that it's not just because you're on the liquids and you're not getting enough food. You should be getting enough nutrients.
Okay.
But the key is that when we do the TIF procedure, the stomach's volume decreases a very, very slight amount, maybe a couple of centimeter cubes.
Okay.
That's enough to actually send the signal to your brain that you're full. So you get full much faster. So most patients get full much faster. If you feel that you're eating or you're not able to eat the amount of food that you're eating, basically your body's telling you need to stop. So that's an excellent question. When you have these bloating feeling or abdominal pain, or you feel like, oh my gosh, really blowing up, that means you need to slow down. And one of the key issues with this is that actually this will help patients maintain a great lifestyle and
So
eat
better,
properly.
right?
Yeah,
Chew their food,
Exactly.
eat slower, chew their food more.
that's exactly correct.
Fantastic.
So it's actually a good thing.
Wonderful. Well, thank you, Dr. Simoni. We're going to kick it back over to Lynn and Dylan. They're going to talk about Dylan's experience on week 3 and 4. We'll be right back.
Good job. Excellent.
Okay, wonderful. Thank you so much, Andrea and Dr. Simoni. There were some great tips. And when Dylan and I were chatting about his post-TIF diet and recovery, he brought up some of those same tips. And like Dr. Simoni said, these are some great life-changing opportunities where you can continue to parlay these things into the years to come. So those tips including eating slower and taking small bites. So that will be something you'll hear throughout the diet advice, and putting your body in an optimal place for healing. So welcome back, Dylan. We're going to talk about week 3 and 4. So now you've progressed a little bit. I know you wanted to touch back on a couple of things in diet 1, or the TIF diet in weeks 1 and 2, and talk a little bit about the clear liquids and the broth that we didn't touch on earlier. Go ahead.
Quick, yeah, it's like so bone broth, like chicken broth, vegetable broth, beef broth, whatever one of those is, suits you. because you'll want flavor. I wanted like some more flavor. You know, I got kind
Right.
of sick of all the same flavors, so the saltiness of those was good. And then towards the end of week 2, I really wanted some change. So I would just
Right.
strain like a chicken noodle soup or just, any kind of soup with a really fine strainer and just like heat up the broth and drink it because it had more flavor than just vegetable broth. So
That's
yeah,
a great tip.
I just wanted to share those things because kind of had to get a little creative towards the end of week 2 there, but that was great. Those things were great for me.
That's a great tip, and thank you for sharing. So if you have a strainer, like something like this, it's what Dylan was referencing. You just hold it over a cup, pour a can of soup that has, vegetables or something in there, and you can at least get the broth out there and give that liquid diet a little flavor kick. So Dylan, in week 3 and 4, we were talking about oatmeal being one of your go-tos during that week. Tell us a little bit about what that looked like for you as far as diet goes.
Yeah, so I just want to say, like, I cannot stress enough to eat slow, take small bites, and just take your time. I think your pamphlet talks about like maybe 15 minutes or 20 minutes per meal, but was so important for me because I tried to eat too fast a couple times, and it you can feel it. It does not feel good. So I just want to like stress that because when you get to week 3 and 4, it's like, okay, I can actually have a couple options here, and I was really excited. So I
Just
just
wanted
want
to
to
take it all in.
I just want to stress that like very, very important to eat slow, take small bites, and take your time. And oatmeal was something I liked. I've always liked, and it's very filling. And you can even add like a little extra water to make it a little more liquidy. Um, and you can put almond milk in it, maybe like a little bit of honey, so it's sweeter. But it went down very easy, and it was very filling. So yeah, that was great, as well as scrambled eggs, just making sure they're very soft, um, and eating them slow, even like a mashed avocado with the scrambled eggs. And then continuing with the protein shake, but being able to add a couple more things, like bananas, blueberries, a tiny bit of sugar. So you can kind of like add a little bit more to the shake, which is filling, and then scrambled
You're
eggs,
just
oatmeal.
pureeing it really, really well when you're taking all that in for the shake.
Totally. Yep. Yeah, you don't want like I didn't want any chunks, any food, anything like that in the smoothie. And then
Right.
like mashed potatoes, very, very well mashed potatoes with maybe like a little bit of gravy. And I think towards the end of week 4, I started adding some like minced ground turkey, like very, very small amounts. But yeah, I think those were the things that kind of 3 and 4 are definitely easier than 1 and 2. And it's kind of relieving. You're like, okay, I can have a little bit more.
Yeah. So that's good. I think those are great tips from Dylan as far as, again, eating slow and continuing those shakes throughout. So the smoothies can be a staple throughout weeks 1 through 6, and then incorporating the things on the food list and seeing what you can tolerate. So I think each person, it's important to point out that each person's going to be a little different. So you're really looking at your body and how you tolerate each new food that you introduce at various times. Journaling, keeping a food journal so you can discuss outcomes with your doctor. But Dylan, thank you for sharing that. Is there any other favorite food that you went to in weeks 3 and 4? Or
I think like the scrambled eggs with mashed avocado and oatmeal were good, and the mashed potatoes very fulfilling. After going 2 weeks on nothing but liquid, pretty much
Right.
anything tastes good. And I
Right.
did lose weight. Yes, just to second that, someone asking that question, I did
Yeah.
lose a significant amount of weight in the first 4 weeks.
wonderful. Thank you for sharing that, Dylan. So after this segment with Dylan, we're going to go through some feedback from other patients who have had the TIF procedure done and some of their diet tips and tricks as well. So stay tuned and join us back here for weeks 3 and 4 with Dylan.
Welcome back, everybody. This is my favorite part, probably. Weeks 5 and 6. We're like at the home stretch. We're at the very end. Not very end. It's always evolving, right, Dr. Simoni? But let's talk about weeks 5 and 6 for the TIF post diet. This is kind of the exciting phase, right? We get to start including the things that we are so used to eating every day. But can you discuss that a little bit? I mean, there might be some adjustment to it, right? We're not just going to cut up big chunks of steak and start eating steak at 5 and 6.
You're absolutely correct. So Dylan and Lynn had a lot of great ideas and information for patients. So as Lynn mentioned, everybody's different. Not everybody is going to progress the same
I love that.
throughout these 6-week periods. So you really need to pay attention to what your body is telling you. If you eat something that is going to make you feel worse, or you feel like it's getting stuck, you may have some other issues. For instance, just to give you a simple example, some patients may have allergies to certain foods.
Oh, yeah.
So that doesn't mean, now that you had the TIF, now you can go and eat those things that you are allergic to. So
Right.
you might have difficulty with eating those. So it is an individualized type of
Diet.
progression and diet.
Sure. Okay.
But we're just going to give you some general ideas as to what you can do in weeks 5 and 6.
I
So
love
weeks
that.
5 and 6, you can start with things that are softer, but it does require some energy to chew them, masticate them in order for them to get softened and you can swallow. Steak would probably be one of the last things
Okay.
I would do in this diet.
Sure.
I think you have ground turkey here,
Yep.
so things that are ground or even ground beef,
Yeah.
or ground chicken. Those are usually best to start with.
Okay.
If you want to try chicken, you can try tender pieces of chicken, for instance,
Okay.
chicken thigh or chicken drumsticks, as opposed to chicken breast, because
Okay.
it's
Drier.
Exactly.
Okay.
So you can try those. You can try a small amount and see how
Okay.
you do. If you do well, then it's something that you can go ahead and continue eating. Pasta, for instance, we have soft cheeses.
Yeah.
You could do that. Notice that here we have.
My two favorite parts right here.
I know, that's why I was holding off for a minute. So yes, in week
Yes.
5 and 6, you can resume having your caffeine or coffee.
Right.
Still, I would try to stay away from carbonated beverages until probably week 7 or so. Wine you can have in week 5 and 6.
In moderation.
Yeah, in moderation, absolutely. Don't go drinking a whole bottle of wine thinking, oh, now I had the TIF, so I can drink. So week 5 and 6 generally is a week that you can have a food that has more substance to it than
Perfect.
the previous weeks.
Perfect. So I know we are talking about diet right now, but there's also questions about exercise and going back to work. So since we're kind of talking about post-op, let's talk a little bit about that, if you don't mind. What does that look like for a patient that's had TIF? You know, maybe the progression, the first couple of weeks. Can they start running? Can they go do yoga? Or, I mean,
So,
I'm asking the questions,
yes,
right, guys?
Of course.
You want to know.
So here's the thing.
Yep.
We want to stay away from exercises that actually put pressure on the diaphragm.
Okay.
All right, things that require what we call Valsalva maneuver. Like, for instance, a lot of squatting, a lot of lifting heavy things. So these put pressure on the diaphragm, hence causes the area that we have done surgery on, or the TIF procedure, for it to separate.
Okay.
You need the 6 week for things to really fuse together well.
Okay.
Again, even for exercise, it depends
On the individual.
on the individual.
Okay.
What are some of the things that you can tolerate? I mean, if you're wearing a weightlifter and you want to be a weightlifter post,
Probably not a good
I
idea.
wouldn't start, especially not during the 6 week period.
Yeah.
But
They won't have any energy anyways to do that.
no, you should.
Maybe I'm
You
just,
should,
yeah.
as long as you get your nutrients
Yeah.
in. So here's the thing. Depending on what exercises you can tolerate, as long as it is not putting pressure on your diaphragm, you don't have to really
Bear
force
down.
yourself, bear down, or lift heavy things. You should be okay. So for instance, walking,
Yep.
the
Sister.
first couple of weeks, not running.
Okay.
Week 3 and 4, I allow patients to swim.
Okay. What about riding a
Alright.
bike or Peloton? I know there's a lot of
Yes,
Pelotons out there.
stationary bike is fine. You can do that within the first couple of weeks
Okay.
as well. The key about biking, as long as you don't have to lift your bike and take it up the stairs or down the stairs, or
Makes sense.
you just want to make sure you don't do that.
Sure.
Now, as far as going back to work, again,
Yeah.
it's individualized. It
Okay.
depends on what kind of work you do.
Sure.
For instance, I've
Type.
done surgery on a lot of nurses and people that work in healthcare. So
Yeah.
I usually put them off work for about 6 weeks.
Oh,
Because a lot
wow.
of times they
They're
actually have
lifting.
to lift patients, they have to lift things. So I put them off for about 6 weeks.
Okay.
Now, if you are, I don't want to be biased, but if you're a computer programmer or somebody who's sitting at home,
Sure.
by the way, don't ride a motorcycle either. so
We are live. I told you, we are live.
so anyways,
Yeah.
as long as you have a desk job and you just don't have to lift anything heavy, you can go back to work within a few days.
Oh, okay.
I've had patients go back to work within 3 or 4 days.
Fantastic.
So if you're a fireman or a policeman or someone that may need to actually get out and help or lift something heavy or lift a heavy hose or something like that, or construction workers,
Yeah.
I definitely have them take out the whole 6 weeks.
Yeah.
I hope that answers the question.
Yeah, I'd be ashamed to go through all of that and, something happens if you lift something, So, well, do we have any questions, Taylor? Thank you, Dr. Simoni. Yeah?
Is it normal to experience chest spasms or esophageal spasms after your procedure? Does it go away?
That's a good question. Do you want to repeat it?
Sure, yeah.
Okay.
So the question was, do chest spasms happen often and do they go away? So yes, a lot of patients after the TIF procedure are going to experience some chest discomfort, and it's going to be different for everybody. Some patients may have severe gripping pain or sharp pain. Those are spasms, and I think we mentioned that earlier.
Yeah.
If you drink
With the
something
hot and
that's-
cold.
yeah.
Yeah.
If it's too hot or too cold, you are going to have spasms. The good news is that it gets better as time goes on.
Okay.
And once you actually advance your diet, because it puts, here's what happens when we do a TIF procedure. So you have changed the anatomy of the lower esophageal sphincter a bit, and it's inflamed. So when you're putting things in your esophagus and it's trying to pass through, your esophagus goes into a spasm, therefore you feel chest pain or chest discomfort.
That makes sense.
It's trying to go through that inflamed area. The sooner you follow the recommendations and you advance to the next diet, then these spasms get lesser and lesser.
Okay.
As long as you're getting diminished, you're doing fine.
Gradual.
It will go away.
Okay.
In some patients, unfortunately, it might last more than 6 weeks. In some patients, it might last a couple of days.
Okay.
So it really is individualized, but just keep in mind, make sure everything you drink or eat is room temperature.
Okay.
Nothing
Big
too
tip.
hot or nothing too cold, because you may have spasms. As a matter of fact, some patients without the TIF
Have
even
spasms.
can have spasms. You know, I don't
Yeah.
know if this ever happened. I hear that if you gulp really cold water quickly, you can
start-
actually cause spasms.
Yeah, well, that makes
So-
sense. That
so
makes sense.
That was a good question. Thank you.
Fantastic. Well, thank you. Thank you for going through that 5-6, weeks 5 and
course.
6. We really
That's
appreciate
exciting.
it. I know, right?
exciting,
That's the best. Remember the
part of
best
it.
part, guys. So we're gonna kick it back to Lynn and Dylan to talk about his experience in week 5 and 6.
Yeah.
Take it away.
Good job.
Wonderful. Thank you again, Dr. Simoni. Great advice and great tips. I think we're hearing a common theme. Again, taking things slow, introducing things slowly, chewing your food slowly, slowing things down a bit, and really paying attention to your body and still keeping your doctor informed every step of the way. So for the weeks 5 and 6, sounds like it's pretty exciting. You get to introduce some really great new things into the diet experience. So Dylan, what was your diet experience like in weeks 5 and 6? And what was a go-to favorite of yours when you're starting to introduce these more solid foods and a little bit more excitement into your diet?
Yeah, no, I'll definitely second everything that was already said. From my own personal experience, it is like a light at the end of the tunnel type thing, and like it is exciting, and it does feel good and hopeful. Yeah, I think like having rice, rice was really good for me with like butter, a little bit of butter, soy sauce or whatever. Rice was really good, and then like really soft pasta, maybe even like overcooked, but really, really soft noodles, with just like, butter, salt and pepper, or like a little bit of olive oil. So rice, pasta, still mashed potatoes, still eggs, still mashed avocados, and like soft fish. I remember like clearly I went to dinner with like some friends at their house, and they were eating other stuff like bread and stuff. But I was able to have like some cod, which is like a white fish, and it was like very soft, with like a clam chowder on the side, and some rice. And I remember that all went down really easily, just as again, like slow, small portions, chew, very good. But yeah, like soft fish. Yeah, and it's a really good time. It's like, okay, you made it through making it through weeks 1 and 2, I think for myself were the most difficult. That was the most difficult time for sure. And then at this point, the end portion here, soft pasta, rice, fish, eggs still. I mean, all those things felt good. And yeah, just paying attention to how my body reacted to each thing that I ate. And just being really mindful of that. And yeah, those would be like probably the top things I would say.
Wonderful. Thank you for sharing that. And then as far as Dr. Simoni and Andrea were talking about exercise, about at this point, what were some of the things you started incorporating back into your exercise regime? I think you told me you're a softball player and you like to run, and So how did that look around this week or shortly thereafter?
Yeah, no, it's a great thing to bring up because I'm a person who really likes to exercise, and it's a a really important part of my life. And around this time, I definitely had started running again, like very mildly. I think I started at like a mile and a half or 2 miles, and just like slowly went up from there. I was definitely riding my bike. Walking, I think, is encouraged. I was walking a lot through this time, but I did slowly start to run again. But just I think Dr. Simoni said, each person is obviously different. Um, but yeah, I did slowly start to run and then increase the mileage. Riding my bike. I think I was able to like play catch, pretty comfortably, but just really like not pushing it, just kind of
Right.
starting to implement those really small things. Like riding a bike and running very short distance was okay. But I didn't want to really push it, like no sit-ups, definitely like
Right.
sit-ups, no lifting weights, nothing like that, but just really light cardio that doesn't put any pressure or cause any like flexing in the abdomen area. Um, yeah.
That's fantastic. Good to hear that you had no issue introducing those things to your routine.
So Dylan's 1 to 2, casual run is about my max. So being able to do those at weeks 5 and 6 is pretty impressive. I'm really curious to know, maybe you all are too, but what did it feel like? What was an emotion that you can express to the audience that when you were able to introduce these foods back into your world, what were some of those feelings you experienced when you see that light at the end of the tunnel? You're right there at the cusp of being able to resume some sense of normalcy. What were some of the emotions you had going on?
Yeah, I mean, are we talking like preparing for week 7 for
Yeah,
those foods?
you're back to normal.
Yeah. Pretty surreal, kind of. I think anybody who's suffered from GERD for a long time, you get to this place where, you just don't eat certain things, and the mind becomes completely closed to those foods, and it's just like the option is off the table, and it just doesn't exist. So yeah, it was pretty surreal. I think would be like the first emotion I felt, like very surreal, very excited, like almost like a kid, like, oh my gosh, I get to eat like salsa, or I get to put hot sauce on like a taco and I don't have to be riddled with anxiety and fear about what it's going to do to me. So I think like, yeah, surreal, happy, excited, grateful, very grateful to have, the anatomy fixed and know that it was going to be okay. Yeah, those would be the emotions for sure.
I love that. Thank you for sharing that. And so when you talk about that, the culmination and that one food that you kept your eye on, that was the prize at the end of all of this. What was that? And what was that experience like when you finally got to partake and enjoy that meal for the first time in 6, 7 weeks?
Yeah, no, that's a good question, and it's a good reflection as well, because I think I met with Endogastric in the studios down there before I had the TIF, and I think I was asked that same question, and I didn't, I wasn't able to have this burrito that I'm going to talk about. I hadn't been able to have it in a really long time, and I think at that time before the TIF, I was really, it didn't seem like a real thing that would actually happen. Um, so yeah, I would get like this chile relleno burrito that is like covered in chipotle sauce, and it's like pretty
Yum.
spicy. Yeah, the sauce is like pretty spicy, Um, and inside the burrito, there's obviously like chile relleno, which is like, a green chile with more salsa or like red sauce on top of that, beans, cheese, rice.
All my
Yeah, so
favorites.
it's like a really heavy food, and it's one of my favorite things. And yeah, like I the first time I got to eat that, it was so good. I was just so grateful, like I was so happy that I finally was given a solution, and I was finally
Yeah.
given answers and like a real tangible permanent solution to this issue that had been plaguing me for so long, that so many people were kind of like trying to tell me that it just wasn't a big deal. So I think coming full circle and reflecting on that was was like, yeah, I was grateful and I was happy. Like, okay, finally.
And how did
Like,
that burrito go down? Were you good?
yeah, it went down great, you know, and I think I waited and waited and waited for the heartburn to come. And I waited and waited naturally for whatever symptom to come, the
Okay, what you thought
chest
was
pain.
potential.
Yeah, like
Yeah.
psychologically, after so many years, it's unavoidable to have those thoughts when I eat something like that. So yeah, I definitely like waited and waited for that to come, and it never came, and it still hasn't come. Like I'm coming up on like a year almost, I think, in August, and I have not had heartburn one time, and I have not
Oh.
taken one PPI, one antacid chewable. I have not taken one thing, and I've eaten anything, you name it, and I have
Hundreds
not.
of burritos.
Yeah, I don't know about hundreds, but all that weight I lost, I've definitely put some back on.
But
Yeah,
it's great. It's great that you were able to have that experience and have it be a pleasant experience, and that longevity is continuing. So I think it's great that you were here tonight and able to share your story with all of us. We're so grateful for that, and I think the folks who have joined us tonight are appreciative as well. You were able to still continue putting any questions and comments that you might have. But we're going to take some time to close out the session here tonight, Dylan, and just want to thank you again for being here and sharing your story with us. Very impactful, and we're so glad to hear you're doing so well after the TIF procedure.
of
So
course. Yeah,
thank you for joining us.
thank you so
All
much.
right. All right, folks, we're going to wrap it up, and I'm going to turn this back over to Dr. Simoni and Andrea.
Lynn. So Dylan kept talking about burritos, and I was looking at all the food on the table, and I decided this is going to be my dinner tonight: some potato chips and wine.
yeah.
Dr. Simoni, are you going to join me?
Yeah,
tonight,
sure.
please?
Let's do it. So yeah. Anyways, but that was great. I mean, hundreds of burritos. Right?
Yes, hundreds of burritos. Well, thank you guys so much for joining us. Before we conclude, I did mention that we are going to do a giveaway for a TIF tumbler. It's an I Heart TIF tumbler. So the winner tonight is Lorna Christian. I think that's the right name. So I hope I said it correctly. But you want a TIF tumbler? We will reach out to you and get that tumbler over to you. Let me just see if there's any last questions,
Absolutely.
Dr. Simoni,
Yeah,
and then I'm going to let
here.
you kind of, if there's anything else you want to give advice or anything you want to
Sure.
say to the folks that are watching. But Taylor, any other questions?
Yes. How many weeks or months until you are 100% better, like the surgery never happened?
I love that question.
All right, excellent question. So in my experience, more than let me repeat the question. So in
How many weeks?
How many weeks or months after you're going to be 100% like nothing has happened, right? So fortunately, more than 97 or 98% of my patients, when they go through the TIF, they feel like nothing has happened as far as having had surgery. But with a new outlook on life, how to control their eating, that they can actually eat everything in moderation. They can drink their wine, eat their chips, have their coffee. I would say the longest that I have really seen somebody who had problems with having difficulty swallowing or having discomfort after eating was about 6 months. So most patients, fortunately, after I would say about 2 or 3 months, they feel almost completely better.
Yeah, I love that.
Yeah.
That was a great question.
Yeah, excellent question.
Yeah, definitely. And if they have any, I wouldn't say complications, but anything come up like the spasm or whatnot, you would recommend them to talk to their doctor, right?
Absolutely,
Yeah,
yeah.
throughout the
Definitely
course.
talk to them, absolutely.
Yeah.
And this particular patient of mine, he actually wanted to have burritos, so it took him about 6 months.
See, it's
to have
those
a burrito.
burritos again
I know,
we
I'm
keep
telling
talking
you.
about. So Dr. Simoni, let's talk about your last words of advice for people that are suffering from GERD. What do you recommend to them? And I feel like you're talking through me right now, and I'm just gonna, because he's been sitting here telling me, have you been scoped, Andrea? Have you done this? So, but really, what would your advice be to these patients?
So first and foremost, if you really have symptoms of reflux, and that not just heartburn. If you have any of the especially atypical symptoms or what we call silent reflux, you really need to get checked. That's the first and foremost thing that you really need to do. See a gastroenterologist, especially someone who knows about TIF and about GERD, and they know what to offer you if there is a problem or if there's something abnormal. Number two is really trying to, even after the TIF, if you've gone through all of this, I heard some questions about weight and whether you want to, you lost weight and you want to gain weight. You really don't want to gain too much weight. So you don't want to go back to having the same bad habits. So if you eat significant portion of food, or you eat erratically, you don't eat anything all day, and then all of a sudden you have a huge meal at night, and you drink your soda and go to sleep, you're going to have a problem again. Okay, so this is not, TIF is not made out of iron or something that's not going to come apart. So if you go back to the same habits that you had, you are going to loosen it up. So really pay attention to your body. I think having the TIF procedure not only will fix your valve and avoid having reflux or GERD symptoms, it also gives you a second chance of how to really control your diet, control your weight, and how to really eat in moderation, to listen to your body.
I love that.
All right, so that's those are my 2 cents.
I love that. That was a perfect way to end this whole session, if you will. But let's remind everybody that's watching, if they want to see you, Dr. Simoni, where can they find you?
All right, you're more than welcome to go on my website. It's www.agimedical.com. That's one word. You can also call my office or send me an email. It's on my website. Again, www.agimedical.com. Or you can go to GERDhelp.com. You can find a physician that's near you who is who's a TIF surgeon and knows about GERD. And last but not least, I just wanted to thank everyone, especially Andrea, Lynn, and Dylan, and also in the Gastric Solution, for making this really possible. This is an excellent education for patients, and I really appreciate everybody tuning in. Thank you so much for all the questions too.
Wonderful. Well, again, I mean, you closed it out. I don't even need to say anything. I'm done. I'm just kidding.
Oh, come on. You're doing great.
This was awesome. I'm so glad you guys joined us this evening. We are going to have some additional special editions throughout our time, but we are going to continue to have our TIF Talks every Tuesday, so please join us every Tuesday, and we will catch you next time. Thank you, Dr. Simoni, for being here.
Good to see you.
We appreciate it. Good to see you. We have to hugs over here.
Yeah, we have been vaccinated.
Yes, we have been vaccinated. Thank you, everybody. Have a great night.
Thank you.